Hello everyone. As you know, worry is a normal part of life. However, when worry becomes excessive, uncontrollable, and persistent over 6 months, it may indicate a mental health condition called generalized anxiety disorder. Today, Mahsa and Anne will be presenting on generalized anxiety disorder. This is one of the most common mental disorders. There are 4 parts in our presentation. First, an introduction with Canadian statistics. Second, background and significance, including epidemiology, demographics, signs and symptoms, social determinants of health. Third, nursing care and evidence-informed practice, including diagnosis, treatments, nursing assessment, and interventions. And finally, a summary and a conclusion. According to Statistics Canada, in 2022, the 12-month prevalence of GAD were 5.2%, meaning about 1 in 20 Canadians met diagnostic criteria. The largest increase was seen among young women from 15 to 24, which is triple from 3.8% in 2012 to 11.9% in 2022. And women reported higher rate of diagnosed anxiety at 19.1% compared to 10.5% among men across all age groups. Young adults from 18 to 34 years old had the highest prevalence with 20.2% reporting an anxiety disorder. There were also differences based on sexual orientation. 13.5% among heterosexual adults, 26.4% among gay or lesbian adults, and 46% among bisexual or pansexual adults. And besides that, individuals in the lowest income quintile had a prevalence of 18.8% compared to 11% in the highest income group. Additionally, non-immigrants reported higher rate of anxiety disorder at 17.2% compared to 9% among immigrants. And in 2023, about 15% of Canadian adults reported being diagnosed with an anxiety disorder. Next, I will talk about epidemiology and demographics. First is comorbidity. GAD commonly occurs with other mental health disorders, especially major depressive disorder, alcohol misuse, or bipolar disorder. Research shows that over 90% of people with GAD experience at least one additional psychiatric disorder during their lifetime. Besides that, the burden of disease, GAD causes significant stress, stigma, and increased healthcare use in Canada, especially in outpatient settings, and its association with substance use disorder. Many people with GAD also have substance use disorder, and the most common are tobacco or alcohol use disorder, affecting more than 1/3 of people with GAD. Demographics. Regarding gender, women have higher risks for GAD than men. This may be due to hormone fluctuations that affect mood and stress response, as well as increased social stress such as caregiving responsibilities. On the other hand, men may underreport symptoms because of social stigma and expectation to be strong and not show emotions. As a result, they are less likely to seek help, and their symptoms may present differently at anger or substance use. Ages. Prevalence is highest among young adults, especially young women aged 15 to 24. MRI studies show brain structural changes in people with GAD occur during neural development, which may explain why GAD often begins in adolescence and early adulthood. Socioeconomic. Individuals with low income and lower level of education have a higher risk for GAD, because financial stress, unemployment, and job insecurity increase chronic stress level, limit access to healthcare, and follow treatment, leading to worse mental health outcomes. Immigrant status. Anxiety disorder were reported less among immigrants than non-immigrants, and among immigrants, though living in Canada for over 10 years, reported higher rates than recent immigrants. Next is signs and symptoms. People with anxiety disorder don't know how to stop the worry cycle, which disrupts daily life. They frequently imagine worst-case scenario, overthinking the future, feel the need to plan every possible outcome, and have difficulty stop worrying or let it go. The symptoms include excessive and uncontrollable worry that occur most days, and they may feel restless, have difficulty concentrating, and become easily irritable. They may also experience physical symptoms such as muscle tension, fatigue, and sleep disturbance. The median age of GAD presentation is 30 years. There are several Social determinants of health may impact GAD condition and outcome. First, genetics. GAD is also moderately heritable, with estimate ranging from 30% to 50%. Variations in genes-related serotonin, GABA, and stress response systems can affect medication and therapy outcomes. Those with a strong genetic predisposition may experience chronic or recurring symptoms. Secondly, adverse childhood experiences such as abuse, neglect, and household dysfunction increase the risk of chronic anxiety. Individuals with prior depression are 3 times more likely to experience moderate to severe anxiety. People with existing mental health conditions are less able to cope with stress and build resilience after crisis or disaster. Education and literacy. Lower education and health literacy may limit understanding of mental health conditions, reduce awareness of symptoms and treatment options, and lead to delay seeking help and poorer health outcomes. Income and employment strongly influence outcome in GAD. In Canada, individuals with lower income or unemployment are less likely to access healthcare services and are more likely to receive pharmacological treatment instead of psychological treatment. This can lead to slower recovery and a higher risk of relapse. Prolonged symptoms may affect work performance, productivity, and career opportunities. Physical environment can significantly impact anxiety outcomes. Housing instability, social isolation, and unsafe environments increase stress and worsen anxiety symptoms. In contrast, stable and supportive housing can improve recovery. According to Ogusu, living in areas affected by natural disaster can increase anxiety by causing uncertainty, displacement, financial stress, and limited access to care. Social capital. Social capital refers to shared social resources, relationships, and networks that help groups achieve common goals. It includes trust, norm, cooperation, shared language, and social connections, and exists at different levels such as individual, school, workplace, neighborhood, regional, national. Because it is complex and multidimensional, its impact on health may be either protective or harmful, depending on the dimension. Higher levels of social capital are generally associated with better mental health outcomes, including reduced psychological distress, depression, anxiety, behavioral problems, as well as improved well-being in children. Evidence also suggests that collective social capital such as shared language, value, and cost has a stronger influence on mental health than structural social capital, which include networks, rules, and roles. Finally, culture plays a key role in anxiety disorder. People from different cultural backgrounds may perceive and express anxiety differently. In some cultures, stigma around mental health can prevent individuals from seeking help, and language barriers may limit access to services. Cultural factors also influence coping strategy and treatment preferences.
Thank you, Anne. Now I will discuss the criteria used to diagnose generalized anxiety disorder. According to diagnostic guidelines, a generalized anxiety disorder is characterized by excessive anxiety and worry occurring more than at least 6 months. These anxiety usually relate to multiple life events or activities such as work, school, health, or relationship. Individuals with GAD often find it difficult to control their worry. In addition to persistent anxiety, at least 3 or more associated symptoms also must be present. The symptoms include restlessness or feeling on edge, being easily fatigued, difficulty concentrating or experiencing a mind that goes blank, irritability, muscle tension, or a sleep disturbance. To meet the diagnostic criteria, the symptom must also cause significant distress or impairment in social, occupational, or daily functioning. In addition, these symptoms must not be caused by substances or medical conditions or any other mental disorder. Now let's review what kind of treatments we have. We have pharmacological treatment, including first-line medications, typically include SSRIs, which are selective serotonin reuptake inhibitors, and SNRIs, which are serotonin norepinephrine reuptake inhibitor. These medications help regulate neurotransmitters in the brain that influence mood and anxiety. Common examples include sertraline, sertraline, fluoxetine, paroxetine, venlafaxine, and duloxetine. And The other medications would be second line or called alternative medications, may include pregabalin, which has a rapid onset, and buspirone or non-benzodiazepine medication used to treat anxiety. Benzodiazepines such as alprazolam or clonazepam may sometimes be used for short-term reliefs during acute anxiety episodes or crisis, but they are generally used cautiously because of the risk of dependence. In treatment-resistant cases, the second-generation antipsychotic, such as ketapine, may be prescribed by specialists. Besides pharmacological treatments, we also have psychological and behavioral therapy, which play a very important role in the treatment of GAD. Cognitive behavioral therapy, or CBT, is considered the first-line psychological treatment. CBT helps patients identify negative thought patterns and develop healthier way of thinking and responding to stress. Other psychological approaches include behavioral therapy, metacognitive therapy, and psychodynamic psychotherapy. And mindfulness-based therapy are also commonly used. These include mindfulness medications, acceptance-based behavioral therapy, and emotion regulation therapy. Supportive interventions such as relaxation technique, breathing techniques, sleep hygiene education, regular physical exercise, and psychoeducation program can also help patients manage anxiety symptoms and improve overall well-being. Let's discover what are our roles as a nurse. The first step is nursing assessment. During subjective assessment, patients may describe excessive worry, difficulty controlling anxiety, sleep disturbance, fatigue, irritability, or difficulty concentrating. They may also explain how anxiety affects their daily functioning. Objective assessment focuses on observable signs. Physiological symptoms may include increased heart rate, elevated blood pressure, rapid breathing, muscle tension, tremor, sweating, or gastrointestinal discomfort. Behavioral signs may include restlessness, agitation, difficulty relaxing, or difficulty cooperating with care. And from a psychological perspective, patient may show confusion, poor concentration, negative thinking pattern, or verbal expression of fear and anxiety. And from the social behavior, seeking reassurance, needing companionship, or withdrawing from interaction may also be observed. Now, what are the interventions that we as a nurse can choose to help patients? Therapeutic communication is very important. Nurses should maintain a calm and supportive presence, acknowledge the patient's feeling, and encourage them to express their concerns and fears. By using simple and clear language, we can help patients better understand the situation. Providing environmental and emotional support is also important. A quiet, low stimulus environment can help reduce anxiety. Nurses should also remain with the patient during severe anxiety episode and help them become familiar with their surroundings. Teaching coping and anxiety management strategies is another intervention. Nurses can teach relaxation techniques such as deep breathing, stress management, and healthy coping strategies. And finally, patient education and safety monitoring are essential also. Nurses can educate patients about anxiety disorder, treatment options, and proper use of medication while monitoring their vital signs, mood, and behavior. In this slide, we introduce some community resources that we have in Barry. Community resources play an important role in supporting individuals with generalized anxiety disorder. For example, the Barry Anxiety Clinic provide counseling, psychoeducation, and treatment program for individuals experiencing anxiety and other mental health conditions. The next is the Berry and Community Family Health Team, which offer integrated health services, including support for mental health concerns. And another important organization is the Canadian Mental Health Association in Simcoe County. This organization promotes mental health awareness and provide community-based services to support recovery and resilience for individuals and families experiencing mental health challenges. Access to these resources can help individuals receive ongoing support and improve their mental health outcomes. Now we can say why it is important to nursing practice. Nurses are often the first healthcare professional to notice signs of anxiety during patient interactions and their assessment. A holistic assessment is essential because many patients with GAD present with physical symptoms such as fatigue, headache, or sleep disturbance rather than clearly reporting anxiety. Therapeutic communication plays a key role in helping patients feel understood and supported. Nurses can also educate patients about coping strategies, stress management, and available treatment options. In addition, nurses monitor medication effectiveness and possible side effects, especially when patients are prescribed medications such as SSRIs or SNRIs. Collaboration with physicians, mental health specialists, and social workers is also important to ensure comprehensive and coordinated patient care is provided. In conclusion, we wrap up our presentation. We have learned that generalized anxiety disorder is a chronic mental health condition characterized by excessive and uncontrollable worry that can significantly affect daily functionings. Because many individuals present physical or non-specific symptoms, this condition may sometimes be underdiagnosed. We also highlighted the key social determinants of health that influence the development and outcome of GAD, and as well as the importance of early assessment and screening. We also introduce evidence-based treatment, including pharmacological treatments such as SSRIs and SNRIs medications, and non-pharmacological treatments such as cognitive behavioral therapy. And at the end, we talk about the nurse's important role as the first-line care provider. Nurses play a critical role in recognizing symptoms, providing emotional support, educating patients, and helping them develop coping strategy to improve their quality of life. Thank you for your attention.